We'll just be doing some housekeeping as we get started if people join a few minutes late. Okay, good afternoon, everyone. Welcome and thank you so much for joining us today. My name is Maura McCauley. I'm the Deputy Commissioner for Homeless and Domestic Violence Programs here at the Department of Family and Support Services. And I'm joined today by my colleagues, Kim Howard, who is a director with the Homeless Services Division at DFSS, and Sandy Soto, Managing Deputy Commissioner with the Department of Housing, along with some additional colleagues from DFSS and DOH who are helping us behind the scenes. A couple of housekeeping notes before we begin. So all participants are placed on mute during the presentation. The session will be recorded and the recording will be distributed following the meeting. You can use the Q&A function to submit questions or comments. If you can please include your name and agency and organization, if that is applicable, we'd appreciate it. We will have time to address questions and hear comments at the end of the presentation, but please feel free to submit your questions or comments through the Q&A function as we go along. So our goals for today are to introduce the Home Investment Partnership American Rescue Plan or Home ARP grant, including eligible activities and qualifying populations, and to share a proposed initial allocation plan for Chicago's funding based on identified need, continuum of care recommendations that came through for all ARPA-related funding and other Chicago Recovery Plan related investments. At the end of the presentation, we will answer any clarifying questions on the grant and proposal and begin to gather feedback from community stakeholders. Next slide. So today's session is the start of our community feedback process around the Home ARP allocation plan. We will also be hosting a session intended to seek input from people with lived experience of homelessness, gender-based violence, and housing instability next Monday, June 6th at 11 a.m. Of course, we will also accept any input from people with lived experience in today's session and through the written feedback session. There is an additional community feedback session that was just scheduled, which will be held on Thursday, June 16th from 12:30 to 2 p.m. We will be including, there is a Zoom link already for it, so that's wonderful. So if you're interested in attending that one, feel free to attend that. There is a public hearing that was originally scheduled for this evening at 5:30 p.m. that we postponed, really so that we can bring a more final proposal for public comment after hearing from all of our key stakeholders. We will be announcing a new date for that shortly, and we'll try to get that out in communication sometime this week. Lastly, today's session is being recorded and the recording will be distributed following the meeting for reference for folks who could not attend today, or if you would just like to review it again as you're thinking about completing the feedback survey. We will be accepting comments on today's session, but all stakeholders will also have the opportunity to provide written feedback through Friday, June 24th on a SurveyMonkey link that is shown here on the screen and will be shown later on as well in the presentation. So first, we want to provide an overview of the Home ARP grant. As part of the American Rescue Plan Act signed into law in March of 2021, Congress appropriated $5 billion in ARP funds to the city of Chicago to be administered by HUD to address the need for homelessness assistance and supportive services. Funds will be available through September 30th, 2030. So I'm sorry, $5 billion was the total appropriated for the country. $71,170,234 is the city of Chicago allocation. And again, funds will be available through September 30th, 2030. Through Home ARP, HUD intends for communities to provide capital investment in permanent housing, to upgrade available stocks in shelter, and to provide rental assistance and supportive services to stabilize people in housing. Additional detail on the grant can be found on HUD's website. The home ARP funds were appropriated to DFSS in the city's 2022 budget process. Because affordable housing development is an eligible activity of this grant, DFSS has been engaged with the Department of Housing on the planning, and the Department of Housing would implement affordable housing activities if those are approved by HUD. And I will just also add that the home grant is an entitlement grant that is a regular grant that comes to the city of Chicago. Typically it goes through the Department of Housing. One of the major differences with the home ARP grant is the specific target populations, the qualifying populations that I'm going to go through here. Also, there are some additional eligible activities that are not typically allowable in the regular home grant. So Congress authorized the use of home ARP funds for 4 qualifying populations. Please note that these populations differ from eligibility requirements of the typical home grant funding and HUD continuum of care funding. The first is households who are experiencing homelessness, and that's really defined by an individual or family who lacks a fixed, regular, and adequate nighttime residence, an individual or family who will imminently lose their primary nighttime residence, and then unaccompanied youth under 25 years of age, or families with children and youth who meet additional homeless qualifications. Then households who are at risk of homelessness, as defined by an individual or family who has an annual income below 30% of median family income for the area, does not have sufficient resources or support networks immediately available to prevent them from moving to an emergency shelter or other homeless destination, and meets additional conditions of housing instability. The third is households who are fleeing or attempting to flee domestic violence, dating violence, sexual violence, stalking, or human trafficking. Please note that this qualifying population is an expanded definition from the COC program definition. And then 4 is other populations that do not qualify under any of the populations above, but meet one of the following criteria. A, other families requiring services or housing assistance to prevent homelessness, and B, those at greatest risk for housing instability. So just a couple of notes about qualifying populations. All jurisdictions must design and administer home ARP program to provide all 4 qualifying populations with access to home ARP projects and activities. Providing access means allowing all 4 qualifying populations to apply for or to be referred to home ARP projects or activities. In practice, this access may not always result in individuals or households from all 4 qualifying populations being served by the home ARP program, but we may not exclude or remove the eligibility of any of the qualifying populations from our home ARP program. However, jurisdictions can also implement a preference to establish the order in which applicants are admitted to housing or shelter, or provided with home ARP project or activity among qualifying. A preference provides a priority in the selection of applicants for a project or activity among qualifying populations, or applicants who are in a specific subpopulation within a qualifying population. For example, elderly or persons with disabilities within a qualifying population. There's a link in the slide to the HUD exchange that really gives a lot more detail about the qualifying populations and how HUD is asking us to establish preferences. And this is really an area where we're seeking feedback from the community in this feedback process. So the eligible activities for the home ARP grant include affordable housing, which is really the rehabilitation of owner-occupied housing, assistance to home buyers, or rehabilitation and construction of new rental housing. It includes non-congregate shelters, which involves purchase or development of shelters for individuals or families experiencing homelessness or fleeing domestic violence, dating violence, sexual violence, stalking, or human trafficking. Tenant-based rental assistance, which covers rental costs for eligible individuals, supportive services, which provide additional support to people in housing for qualifying populations. And then it also includes eligibility for administrative operating costs and capacity building for the city and for the delegate agencies that are implementing these activities.
Hello,
and now
everyone.
I'm going to pass it over to Cindy.
Thanks, Maura. Hello, everyone. Thank you for joining us. I am here on behalf of the Department of Housing, and we've been working very closely with the Department of Family and Support Services. So I'm glad to be able to share with you a little bit about the work that we're doing. But as Maura noted, we're really looking for community feedback. So this is the first of a couple of events that we have prepared for you. And then there'll be a period of public comment as well that you can submit. But in terms of a needs assessment, so part of the stipulations from HUD is that we needed to run a housing needs assessment. So we were able to compare the number of families living at various income levels to the number of housing units that those families could afford to rent without being housing burdened, so below the 30% AMI. And approximately 130,000 families in Chicago make 30% of the area median income that we were able to point to from our housing needs assessment. So it's 30% of the area median income or less that 130,000 families represent. But there are about 79,000 housing units available in the city that would be affordable to these families. So this leaves about 50,000 units that we are still in need of in order to fulfill the gap. So for context, 30% AMI is 25,000 a year for a family of 2, and about 34,000 a year for a family of 5 make up the 30% AMI. In the 30 to 50% AMI category, there are more affordable housing units than there are families. We were able to identify approximately 221,000 units, about 79,000 families. But this does not mean that there is no housing need in this category. And so just for context, I know sometimes the AMI could be jargon that can be hard to decipher, but 50% AMI is about $42,000 a year for a family of 2, and about $56,000 a year for a family of 5 make up 50% AMI. About 3 and 4 of 30% to 50% AMI renters are housing burdened, about the same percentage as for 30% or below AMI residents. This analysis helped us with this effort with DFSS to develop the home ARP allocations that we'll be discussing throughout this presentation. The next slide, please. And I think I'm turning it over to you, Maura.
Great. So after the American Rescue Plan was passed by Congress, the continuum of care, the Chicago Continuum of Care worked with an ad hoc working group that involved a wide range of stakeholders who came together and made recommendations to the city of Chicago and the state on funding needs that the COC believes would put our continuum closer to our goal of preventing and ending homelessness in Chicago. So the recommendations were for all ARP funding coming to the city and to the state, including the home funding, along with all of the coronavirus state and local fiscal recovery funds. So this slide just kind of outlines what the COC recommended in those initial recommendations. And our home ARP proposal is really working to, match these COC recommendations for both priority activities and the percentage share of funds that we're proposing to fund each activity, and also taking into account other investments the city has made in the Chicago Recovery Plan in these program areas. So the COC relief group prioritize the following program models. So creation of new permanent supportive housing units Based on the COC pipeline committee projected needs for units, the recommendations are to dedicate 64% of ARP funding to permanent supportive housing. The next activity is acquisition and rehab for non-congregate shelter. And non-congregate shelter, just to break that down, is really defined as individual rooms with individual bathrooms for an individual or a household. Based on need, the city funds approximately 1,100 beds that operate in congregate spaces with 20 or more people and shared bathrooms. And so the recommendations from the COC were to dedicate 21% of funding to help really transition our shelter footprint from a congregate footprint to this non-congregate individual room environment. Then tenant-based rental assistance is used to subsidize housing options for people who are in need of housing, but who may be able to access their own supports to maintain housing through community-based services. Through a couple of different venues that the COC has been working on over the last 18 months or so, we have initial information to demonstrate that we can open up over 1,000 units of PSH by moving people from PSH onto other subsidy programs. Additionally, the Expedited Housing Initiative, which is a rapid rehousing initiative, is estimating that many people will need a subsidy once their time-limited subsidy ends. And I know the Department of Housing is also looking at ongoing rental assistance needs of individuals who are utilizing some of their rental assistance programs. So there's a lot of need being demonstrated in this area as well. And the recommendation from the COC was that 7% of funding should go towards that activity. Then rapid rehousing is a housing model that couples time-limited assistance. It's usually 12 to 24 month subsidies with tailored housing focused services. So the COC's pipeline committee established an estimated need for 4,600 new rapid rehousing units to our homeless system and recommended 5% of ARP allocations go to the rapid rehousing creation. And then other critical service funding. There's some of the services are included in the categories above, but in addition to services that are attached to housing, the COC is also recommending that there's an investment in system coordination, employment and income services, and homelessness diversion services. So services that could prevent people from coming into the shelter system. And so there are some ideas for that came through the COC recommendations, and the recommended percentage for that activity is 3%. So again, as we contemplated the allocations to bring for community feedback, these helped inform what DFSS and DOH are proposing for the home ARP, which is just one piece of the recovery funding coming to Chicago. Okay, so the remaining part of our presentation will be the initial proposal from DFSS and DOH on the allocation of the home ARP funding. We are seeking input on the following. Really interested in feedback on the proposed funding allocations between eligible activities, which of the qualifying populations, if any, should be prioritized for these activities, and then any other comments that you might have on the activities and the programs that are proposed. You can provide input during today's session in the Q&A box, but we are also accepting feedback through this survey through June 24th.
All right. So this is, I think, probably one of my most joyful slides to give whenever I give a presentation, which is to talk about how the Department of Housing likes to operate and the foundation that we have set, particularly under the leadership of Commissioner Marisa Navarra. And so a couple years ago now, the Department of Housing underwent a redesign of our mission statement and came up with our vision and value statements as well. And in these statements, and it's important for us to really note this because this is across the board. It's not just something that comes out of the, my division or another division. This is really embedded across the Department of Housing, which is to really create affordable, safe, and healthy housing in every aspect of our work. We have identified and we stated often, right, that we have 77 communities, all of them need affordable housing in one way or another, some more than others, but that's where the equity components come about. And then we also like to make sure that we keep in mind the populations that have been most harmed or marginalized due to racism, discrimination, redlining. So we've also noted, and you can see more about our values and how we've particularly noted populations that have been historically marginalized, like people returning from prisons and jails, immigration, the LGBTQ community. It's really important for us to call this out and be able to speak about it honestly. And it gives me great pride to know that we as a department have decided to really take this on and embed it in all of our work. So you can read more about the mission, values, and vision statement on our website. I wanted to note it here so that you know the lens in which we're operating under. The next slide, please. So one big component of the department, as many of you, if not all of you know, is that we develop permanent housing. And when we have opportunities such like this one to embark in permanent supportive housing, we really try to consider all of the different tools at our reach, not only with this opportunity with CRP money or ARPA money or bonds, depending on what program we're talking about or initiative. We also ensure that we can couple it and really kind of create a stack of different opportunities that might be coupled with low-income housing tax credits or AHOP, home, TIF, if we own land. So we consider this as we look at the development of these projects, but in particular, for these efforts, we make sure that we think about what is currently at our reach, what are the resources that we can really make sure that we expand and that we take into account as we look at how we are developing these projects. So when we look at the permanent supportive housing, it definitely will come with these different layers that are at our reach. And the team, and it's made up of Matt Stern, who's on the call. His team is growing and he's under the multifamily team. So he's leading this effort for the multifamily team in the Department of Housing. But we'll be looking at all the different avenues in which we could infuse additional funds to ensure that we are providing the best development, either with this project and or the other projects, of course, that we can based on our funds and resources that we have. The next slide, please. So what we are proposing for this particular effort is under home ARP, DOH, and DFSS proposed to spend $25.6 million, a little bit over 25, on the development of permanent supportive housing. This is about 35% of Chicago's entire home ARP allocation. The amount of housing units this will produce will be dependent on how financing is structured, but it is combined with 4% LIHTC. So again, kind of going back to what are the resources, how can we stack them? So it's about 4% LIHTC credits that we expect to develop approximately 93 units of new permanent supportive housing. So just for this particular effort, we have other projects underway as well. This is also dependent on changes in development cost. We've been seeing prices go up substantially in recent months due to the pandemic. And the increase in funding or increase in prices, I should say, is about, including that, is about $400,000 per unit in the current total development cost of the department, which we're seeing across the board. About 4% LIHTC credit should provide approximately $130,000 per unit. So about 25 million, about 270,000 per unit equals to 93 units. Per HUD rules, home ARP projects are expected to serve all 4 qualifying populations as discussed earlier by Maura. This includes people who meet the federal definition of homelessness, but also populations at risk of homelessness, fleeing domestic violence or sexual violence and human trafficking, as well as those at greatest risk of housing instability. We're excited to use this opportunity to work with developers and service providers to bring permanent supportive housing online that serves all 4 of these qualifying populations, including returning citizens or residents, domestic violence survivors, and the doubled up community, which I know we've already talked to some of you about, along with those who fit the federal government's traditional definition of homelessness. We're in the process of developing a plan that identifies how we will prioritize each of these populations for new permanent supportive housing development. Whatever home ARP money comes to the Department of Housing for development of permanent supportive housing, these investments will not be in a vacuum. Department of Housing and the Department of Family and Support Services are receiving funding via the Chicago Recovery Plan for a wide variety of housing investments. So just to kind of go over a little bit more of what we're also doing, it's $35 million for new permanent supportive housing, $30 million for the acquisition of non-congregate shelter space, $75 million for new affordable housing. And we continue our department's regular work, including working with partners to finance new affordable housing development. And the department runs many of the other programs to help low-income Chicagoans. I saw a little note there about an issue with evictions or lockouts. We can share resources on that as well. But our goal is kind of going back to our mission statement, is to build healthy, accessible homes for all of our 77 community areas, for all the residents of the city. The other programs that we also offer in conjunction with all this wonderful work that we're undertaking is housing counseling centers, home repair programs like the senior accessible repair program that we have, acquisition and rehab programs, and a lot more. I'll be sharing a link to a site that we've been working on that kind of breaks down who our community partners are, some of the programs that we offer, and hopefully really makes it easy to navigate in case you're looking for any other information that might be available to housing, either with DFSS or another agency in the city. So with that, I'll turn it over to Kim. Thank you.
Okay, I think I'm introing DFSS and then I'll turn it over to Kim. So just a little bit of an overview of the Department of Family and Support Services. We are the City of Chicago's primary social service funder and administrator. We do a wide range of services from childcare all the way up to senior services. And we do most of our work through a network of community-based organizations, though we do provide some direct services at DFSS. But our main priorities are to make sure that we are delivering, high quality, comprehensive services that allow people to thrive in their communities, partnering and collaborating with our delegate agencies, as well as our fellow city agencies like the Department of Housing, to really advance systems change and also help to improve Chicagoans' lives and make good use of the resources that are coming our way. So the home ARP funds will sit in the DFSS homeless division, though we will partner with our Division on Domestic Violence and the Department of Housing, among others. And DFSS primarily funds in the crisis response side of the homelessness response system. So that's really shelter and street outreach, a small amount of rental assistance, some services in permanent supportive housing. And then we rely critically on the Department of Housing and the Chicago Housing Authority and the COC to really make the connection to housing, to help people move to housing when they do become homeless, because we know that is really the solution to homelessness. And so we're really excited to be partnering with DOH on this initiative, along with several other initiatives that Cindy just touched on. that go beyond home ARP to really strengthen prevention and housing resources for Chicagoans during this time. So with that, I'm going to turn it over to Kim Howard, who will walk through the rest of the proposed allocations.
Great, thank you, Maura. Hi, everyone. Kim Howard, Director with the Homeless Services Division here at DFSS. And I will take us through the several proposed projects that would be administered through the Department of Family and Support Services with home ARP funding. So to be clear, these would be in addition to the $25.6 million investment in permanent supportive housing that Cindy mentioned through DOH. So first, DFSS is proposing allocation of $20 million in home ARP funding to the acquisition, rehab, or construction of non-congregate shelters. This is based on sort of an initial survey of need and preliminary estimates from shelter providers. And with this funding, we estimate that this investment could support transition of 300 shelter beds for people experiencing homelessness or fleeing domestic violence, dating violence, sexual violence, stalking, or human trafficking to non-congregate settings. Funding for these projects would be administered through a competitive funding process, so exact impact would depend on selected projects. Second, DFSS is proposing allocation of $8 million to supportive services, and specifically envisioning that this allocation would be dedicated to households in permanent supportive housing units developed by DOH. Based on sort of system estimates from CSH and from Chicago's flexible housing pool, we estimate that this $8 million would serve roughly 95 to 120 households for about 7 years. And again, these would be tied to the permanent supportive housing units. These funds would also be awarded through a competitive funding process. Then third, DFSS is proposing allocation of $8 million in tenant-based rental assistance, or Tbra, to fund a pilot program that we estimate would serve roughly 100 households annually. The Tbra pilot would provide rental assistance, security deposit assistance, utility deposits, and utility payments to households who may need a housing subsidy to exit homelessness or maintain housing, but can sort of otherwise maintain housing through community-based services. Thanks. So lastly, DFSS and DOH are proposing that remaining funding of the home ARP grant would be allocated for operating capacity, capacity building, and administration and planning funds to carry out the activities of the home ARP grant. So specifically, first, we're proposing $3 million for nonprofit operating capacity. So this would be sort of operating costs such as employee salaries, rent, utilities, insurance, equipment, specifically dedicated for nonprofits that would be funded for implementation of home ARP projects and activities. Kind of an important note here, home ARP funding in this bucket would specifically be for the general operating costs of the nonprofit organizations. It would not pay for the actual costs of administering the program, such as staff to deliver supportive services or administering Tbra. That's included in the project buckets that we already talked through. Second, we're proposing $1.5 million for nonprofit capacity building. And this would be sort of operating costs that would result in expansion or improvement of an organization's ability to successfully carry out the eligible home ARP activities. So these costs could include salaries for new hires or training or subcontracting for TA, for technical assistance or support. And then lastly, we're proposing $5 million for administration and planning. This would be for the city, for subrecipients, or for subcontractors to actually administer the home ARP program, so which could include sort of costs for program management, coordination, monitoring, or evaluation. So as mentioned earlier, the proposals that we've walked through today were drafted within the context of other Chicago Recovery Plan investments. So I'll quickly run through the list of sort of other investments already in place with American Rescue Plan and related funding through DFSS. And just to note that additional information on these commitments can be found on the City of Chicago website with the link at the bottom of the slide here. So first, DFSS has already committed $20 million for shelter infrastructure investments to repair and renovate Chicago's homeless shelters, including conversion into sort of a more non-congregate setting. So to be clear, this $20 million is in addition to the $20 million that's being proposed with home ARP funding today for a total of sort of $40 million for shelter infrastructure improvements. Second, DFSS has already invested $20 million in rapid rehousing services, which includes housing location, rental subsidy, case management services to help households rapidly exit homelessness into housing and to keep them stable. And this is continued city investment in an expanded rapid rehousing portfolio that was launched with the Expedited Housing Initiative with CARES Act funding. And then these sort of last 5 investments are part of the City of Chicago's citywide strategic plan to address gender-based violence and human trafficking. So this includes $5 million in rapid rehousing services for survivors fleeing violence. This includes $5 million in emergency financial assistance, which is direct cash to support survivors' immediate needs, such as transportation, childcare, or emergency medical costs. Also $4 million for legal representation and administrative legal support for survivors, $5 million for victim services for young people. So specifically sort of wraparound services to support young people aged 0 to 17 who've been impacted by gender-based violence. And lastly, $1.2 million in prevention resources to provide sort of tailored, culturally specific prevention education for students and caregivers. And again, sort of all of more information on the Chicago Recovery Plan can be found online. This is not sort of an exhaustive list of human services investments through the Chicago Recovery Plan. So for example, many of you may have heard of the Resilient Communities Cash Assistance Pilot that's also being operated through DFSS to provide direct cash assistance to vulnerable households. There's also some investments through the Chicago Department of Public Health, including a high utilizer diversion project to provide behavioral health services to support stable housing for high utilizers of emergency services. So with that, that's been a lot of content, and we want to now open up for some clarifying questions, and then again, any comments from stakeholders who are ready to provide comment today. But we will be seeking, we'll be recording this session, sharing this out, and then accepting written feedback through the survey on your screen through Friday, June 24th. And again, specifically, we're really interested in feedback on one, sort of the proposed funding allocations between the eligible activities that we talked through today, input on which of the qualifying populations, if any, should be prioritized for any of the eligible activities, and any other sort of comments on activities or programs proposed. So I think we have gotten a few questions already through the Q&A. Please go ahead and if you have questions, put those in through the Q&A feature and we will be taking those. So I'm going to take a look at sort of what questions we've gotten so far that we can answer. And we'll be distributing Maura and Cindy to all of us. Okay, I'm going to start with a question on set aside. So we received a question, which is which of the priority areas / needs assessment recommendations will be set aside for survivors of gender-based violence? So this is a great question. As you can see, sort of through what Maura talked through with the qualifying populations, sort of how home ARP prioritization of subpopulations to be served differs a little bit from sort of how we've thought about set-asides in the past. So we are definitely seeking feedback from community stakeholders on sort of which populations to prioritize for each eligible activity which should include sort of survivors of gender-based violence as sort of that third qualifying population.
I also add, Kim, to that, which is the work that's coming out of the office that Darcy Flynn leads for the mayor's office. They've already set aside a number of different initiatives for survivors of domestic violence, for the human trafficking community. So it will be coupled with some of existing initiatives that have been announced. And then just separately, the Department of Housing has also taken that deliberate approach, going back to our mission, vision, values, to ensure that we're also considering the needs of people fleeing violence, whether it's domestic violence or human trafficking. So we've already made some changes in-house as well, including bringing on board the network. It's a new delegate agency for the Department of Housing, but having just their expertise at the table with our other partners has also allowed us to incorporate the different needs and issues that arise for the domestic violence and human trafficking community.
Great, thanks, Sandy. I see another good question in here about sort of what will be the plan for continued funding after ARPA funds expire, particularly for any new housing units created by the funding. So I can start here, and then Maura and Sandy, if you want to chime in with any additional thoughts. So I think, recognizing that home ARP funding takes us through September 30th, 2030, I think sustainability is sort of a key issue that the city needs to think about with this funding. So, if we elect to use this funding for supportive services or for infrastructure, either way, we sort of need a plan for gradual either phasing out of the program after 2030 or, additional, identifying another funding source to take us beyond that 2030 period. So definitely one of the, we welcome ideas on how the sustainability factor would sort of lead us to certain allocations over others, and any thoughts on funding sources afterward. But that is absolutely an issue that we'll need to address.
For the Department of Housing is going to be what we end up developing and how we stack up our existing resources with these dollars to ensure that there is long-term support, something that hasn't escaped us, but it will ultimately be determined once we have project or projects identified with this particular effort.
Great. A clarifying question on the non-congregate shelter activity. Will some of the funds for rehab be used to make shelters accessible for those with disabilities and for seniors? That's a great question. So there are accessibility requirements for any of the construction, rehab, or acquisition projects under that non-congregate shelter bucket. So it definitely is an accompanying goal that these funds will make shelters more accessible to people with disabilities, seniors, or anyone with sort of mobility needs. I will note that shelter renovations are also part of the 20 million that is already dedicated to shelter infrastructure in the sort of related Chicago recovery plan. So we have a little bit of flexibility of using either home ARP funds or other city funds for those projects. Let's see, I'm going to, Cindy, I think this question is for you. We have a question on closing the housing gap by leveraging Airbnb units. So specifically, has there been any thought to closing the housing gap by leveraging Airbnb units that are sitting vacant? I know I've heard there could be a vacancy tax applied to help fund after these ARP funds would expire. For those who are concerned about long-term viability. I'm also thinking links to state referral units could be another option.
Daniel came online. Were you going to respond to that?
I can, or
Okay.
I'm happy for you to
Yeah.
as well, but I can. Yeah, so that's a really good question. I haven't seen any proposals, I don't think, around Airbnb or other home sharing units specifically. I know there is an ordinance that was introduced last month, I think, around the vacancy tax. We're still having conversations with the Alderwoman and some of the advocates around that proposal. So I think that's still pretty preliminary. But agree around long-term viability. I mean, I think that comes back to just the discussion of needing to identify long-term revenue and funding sources for these projects. So it's still preliminary on that particular piece, though. And I apologize, I didn't introduce myself. Daniel K. Hertz, I'm Director of Policy at the Department of Housing.
Okay, thank you. Okay, Maura, I might send this one to you. A question for DFSS. Does supporting the 311 response system for requests to shelter in extreme weather figure into the recommendations or plans for funding?
I think that strengthening our shelter system with the non-congregate acquisition line does tie into just overall access to shelter beds, so that, as we just went over, they will be more accessible to people with mobility needs, for seniors, for others who may just prefer, and understandably so, the dignity of their own room and their own space. So I think that is overall part of our vision for the shelter system, along with improving access. It's an indirect, I think, benefit to that system. Great. Okay, we're getting a lot of questions about preferences for priority populations. If we could actually go back to that slide, I think maybe it would be helpful if we talk through that piece one more time.
Yeah, sorry, Kim, what was the slide we're looking for again?
I think it's
Slide 6 on qualifying populations.
Yep, gotcha.
Thanks. So I'll take this one, but basically to sort of reiterate what Maura had shared. So there's 4 qualifying populations under home ARP. So folks who are experiencing homelessness, at risk of homelessness, fleeing or attempting to flee domestic violence, dating violence, sexual violence, stalking, or human trafficking. And then other populations, which is defined by sort of the specifics here, but gets at folks who have previously qualified as homeless would become homeless again if without sort of additional supportive services or assistance, or those who are sort of at greatest risk of housing instability. So all jurisdictions must design sort of their entire home ARP program to provide all 4 of these qualifying populations with access to the projects and activities. There's a bit of a difference here between sort of access and necessarily being served by each of these activities. And so that's where we get into preferences. So jurisdictions can implement a preference for any of the 4 qualifying populations, or for a subpopulation within the 4 of these qualifying populations. So for example, a jurisdiction could choose to prioritize sort of individuals who are homeless over the age of 60, for example, to be prioritized to first be served by any of the home ARP activities or programs. So sort of how that gets implemented can happen in a couple ways. So it could be through sort of the referral process, that applicants are selected sort of first if they meet one of the priority preferences. It could also be in the way that the jurisdiction administers the funds. So through sort of a funding round, the city could sort of award additional points to programs that indicate that they will specialize in serving one of the qualifying populations. So I think for a lot of the questions that I'm seeing about preferences, this is, I think, one of the key places where we're very interested in sort of community feedback and input on sort of which qualifying populations might be prioritized in each of the specific eligible activities. Yeah, and specifically one of the questions I'm seeing is about referrals through the coordinated entry system. So basically, I think the first step for us would be to understand sort of the recommendations around which qualifying populations would be prioritized, and that would determine then the referral pathway. But for coordinated entry, that would of course only at this point be if the population prioritized was sort of QP1 here, folks experiencing homelessness.
There was a question here about racial equity. How will we ensure racial equity? I'm happy to answer that. Racial equity is something that we thrive for. It's not necessarily always something that can be guaranteed in any work that we do because it's such a complex issue. But different ways that we will ensure that we have looked at racial equity and how it shows up in the city is through the way in which any kind of access point starts, if it's a community partner or property manager or whatnot. What are the different access points for the community? We will ensure that it also is representative of amenities in an area that would help the population that we're trying to serve. So what we have in our control in terms of location, funding, trying to remove barriers for access to these units will be very important. And through that process of also getting your community feedback, we will look at how this can make sure that this speaks to the needs of undoing systemic harms that have long existed before any one of us that we continue to thrive for. So that certainly is going to be an aim, that there is not only a location that really meets the needs of the permanent supportive housing residents, but also a location that is important to the community at large, to the residents so they can get to where they need to, thinking about transit and everything else. We will be looking at how all of those components show up for how this project ends up evolving into. So definitely we'll continue to build in the different components that we currently build in when it comes to screening for housing access, when it comes to the development, when it comes to funding, and when it comes to opportunity areas across the city.
And I would just add that I think all of these opportunities will come through competitive RFP processes, and equity, I know for DFSS is a big area of focus within our procurement process as well. It's something that we're focusing on quite a bit intentionally as well. So in addition, I think to what Cindy said, I think those are also factors that will be really considered and prioritized as we roll out the process to select and implement new projects.
Great. So I'm going to next take us to a couple questions about the supportive services proposal. So Raymond, if you could take us to slide 15. Perfect. So just to reiterate here, I think we have two sort of places that I see that we're getting questions on. So one is the 8 million in supportive services to be tied to permanent supportive housing units developed by DOH. So I think this gets to, we have a question on what funding will support the operating costs and service costs for the 25 million in capital funding for PSH. So to answer sort of part of that, this supportive services 8 million is intended to be sort of the paired funding for the PSH capital funding, with, of course, the note that this would be available through 2030. And then we also have another question on, could you provide more information on the supportive services that would be available through this funding? So the sort of current estimate for supportive services here is based on sort of average permanent supportive housing, supportive services costs. I think primarily, case manager, staff salaries. But I think there is sort of a range of supportive services that are available under the home ARP funding source, and we can share sort of this specific HUD fact sheets that dive into the details of sort of which supportive services are eligible. Okay, just taking a look through to see additional questions coming in. Cindy, I see a few questions for DOH, including, I'm not sure how many of these are sort of can be answered live. As an example, it sounds like the home ARP allocated by DOH would be directed to 4% tax credit bond deals that have a funding gap. Will funds be awarded through a competitive process? Is that something you can speak to today?
The 4% does not go through the competitive round. So that would be something that we can stack onto these projects. If there are other funding sources that maybe do need to go through what we call the qualified allocation plan, we will have a round next year. It could be that, maybe it might show up there, but the 4% wouldn't go through the competitive round.
There's also a question here on whether legal services to help seal old evictions will be budgeted into supportive services or elsewhere in the home ARP proposal, or legal services offered to veterans who are having trouble with their discharge status, which could help them leverage more accessibility to veterans' housing or healthcare. I can quickly chime in on this one and let others chime in as well. We don't currently have sort of dedicated funding in this proposal for legal services outside of the supportive services that would be attached to folks served in the permanent supportive housing units. But we are seeking feedback on these sessions, and so welcome sort of input on the need identified there and any recommended funding for those activities.
And I would note that the Department of Housing, I don't know if Daniel, you're still on, but we do have a right to counsel program. It is just getting started. We awarded the grant to 2 entities to be able to provide free legal assistance in eviction court. Daniel, do you want to speak more about when maybe that program is going to be available for the public?
Yeah, thanks, Cindy. Yes, that should be rolling out later this summer. It's $8 million of emergency rental assistance program funds over 3 years. So it's a rent-to-counsel pilot program, as Cindy said, with led by 2 delegate agencies, Beyond Legal Aid and the Lawyers Committee for Better Housing. So that is something that we'll be rolling out, like I said, later this summer.
Great, thanks. So I'm going to give a few more minutes for folks to keep adding questions into the Q&A.
There's a question here about the rental assistance, Kim, and maybe that has been responded to. But just to note, the city did have a rental assistance program that we used through the emergency rental assistance dollars that we received from the federal government. Our program is closed currently. I don't know if there's one of it, if it's open for DFSS, but they have an ongoing program. I can turn it over to you all to speak about that. But for the Department of Housing, the rental assistance program has closed for now. And, you know, hoping if we were to be awarded again, we at least have the infrastructure for it now. Mora, I don't know if the RAP is available right now or not.
Yes, the DFSS rental assistance program is, the portal is open and we can put that in the chat. So you can apply online through that portal or by going into any of the 6 DFSS community service centers, and we still have funding to spend.
Great. So I'm seeing a couple sort of related questions on timeline, next steps, RFPs, or when these funds are going to be available. So just to give a sense of sort of where we're going next, we are sort of kicking off our community feedback process today, but in the next month we'll be, you know, compiling community feedback that we get from this session, our session on Monday, our session on the 16th, and any sort of written feedback that comes in ahead of June 24th. Following that sort of community feedback, the city will be working on updating a proposal and then bringing that back to a public hearing in July. And then following that public hearing, we'll submit the final allocation plan to HUD for approval, and funds will be available once we receive HUD approval.
There's a question here about the doubled up community from Diane. Hi, Diane. Thanks for the question. This has been an important topic of conversation for both DOH and DFSS, but DOH in particular, in that the homelessness community has been one that we've been looking at more closely than in the past. Going back to our mission, vision, values, you know, really thinking about a people first approach here. So we've been in conversation with some community organizations about this, and they've reached out to us when the announcement of these dollars was made. And so we already have a bit of a plan in place, but we'll be looking for feedback from you all before we really determine how specifically this would serve the doubled up community. But certainly, as you can see, they would probably fit in a lot of these different categories, if not all of them. So we're in conversation, Diane, happy to keep you in the loop. We really welcome your thoughts on this issue as well. So if you and or anybody at Communities United want to give us you know, some thoughts, recommendations, please feel free to do so. We're considering this population more closely now as well.
Great. So another question I'm seeing coming in is, are these funds annually awarded? Are they awarded for several years? So this would be determined sort of once we finalize the allocation plan and which eligible activities we're funding. That sort of implementation detail would be part of the competitive funding process to determine, you know, which programs, sort of the contract period for various programs. Okay, I think we may have made it through most of the ones we can answer today. Unless Maura or Sandy, you see any others that you'd like to chime in on?
I think we answered Chris's first question. If we did it, Chris, feel free to pop into chat or put in another question or note that you're still looking for information on the financing of the units long-term. In the prevention lens, how much of these funds could be front loaded for homeless diversion? Will this be made available to those who have housing instability but aren't literally homeless? I can maybe take that second question. I'll turn it over to DFSS for the first one. Maybe going back to Diane's question about the doubled up community, that community wouldn't necessarily fall under the federal definition of homelessness, or maybe what would necessarily be applied across different programs, because they are quote unquote housed. So we are looking at how we could support people who aren't, as you put it, literally homeless. So this will all be determined after our consultations, our events with the public. We'll be able to identify more specifically how we serve those that don't fall under the federal definition of homelessness.
Great, thanks so much, Cindy. Okay, well, I think with that, I think we can go ahead and wrap up. But again, of course, this is the start of the conversation. We'll be sharing out this recording with folks who joined today and others, and please review and please submit written feedback through the survey ahead of Friday, June 24th. We really are looking forward to hearing thoughts and input from the community on whether the proposal shared today still sort of reflects the need that we see and can best serve the folks we all are working to serve. Any last thoughts, Cindy and Maura, before we wrap?
I would just say, I know there's a lot of information and it's a little technical. So, we are happy to answer clarifying questions, but also if you're interested in just kind of doing your own research and you have that capacity, the HUD Exchange website that's linked in the slides for the qualifying populations has a lot of material that is breaks things down. So as if you're working with different groups and you're kind of thinking through how to give feedback, that's a great resource that we encourage you to use if you're able to. But you can also feel free to send questions our way and we'll do our best to answer them as well. And thank you so much for joining us, and we look forward to your feedback.
Thank you. We'll close it out now, if that's okay. All right.